Thank you. My name is Ben Rollins, and I'm excited to talk to you today about a great technology out of Cornell University. Now, what is this technology? Well, it's a device that screens for life-threatening diseases. It looks like this, a handheld device and a cartridge that receives the blood, and you receive output on this analyzer. Now, this is a multi-billion-dollar market. We're first targeting heart disease. Now, what makes this special, though, is that you can receive results in minutes instead of days. It's 1,000 times cheaper than the current product. It's smaller, high margins, and we currently have a lab prototype. Now, the need for this is that there's a great need for rapid and early diagnosis and screening of diseases such as cancer, heart disease, and brain illnesses. One of the major current solutions is this large machine. It's a mass spectrometry machine, and this machine, there are some drawbacks to it. You see, it's large. It's the size of a refrigerator, and it costs hundreds of thousands of dollars. Because of this, it can only be found in large hospitals or major research institutions. When a doctor orders a test, it can take hours or days to receive results, and it's complex. It must be run by lab technicians. Now let's compare this to the device, the Bpmbyx device. The size of our device, well, it fits in your hand. It only costs a few $1,000s. And because of this, it can go in any physician's office across the country instead of just hospitals. Instead of hours and days, it takes just a few minutes for results, and it can be run by anyone. You don't need to be a lab technician. Now, we're first targeting heart disease because it's a big problem. A third of deaths globally, nearly $400 billion spent on it in the United States, and an American ends an American life every 33 seconds. And in fact, screening and diagnostics are underused 50% of the time for this disease. Now, our solution is to provide early detection. So you're over 30, you go into the doctor's office for your yearly checkup. The doctor takes a sample of your blood and runs it on a machine, and in minutes he or she can tell you your risk for heart disease. He runs it against 16 tests that are all found on one little chip. We call it a physical on a chip. Now, the technology is aptamers. You heard a little bit about them earlier. These are sensing molecules that bind tightly to the target molecule, in this case, a heart disease molecule. Now, there's been a lot of study on aptamer sensors. 800 publications were put out last year. But there's been a problem on using these aptamers in diagnostic devices. It's been able to detect the binding event in a commercially viable way. Well, that's what our team has been able to do. We've been able to show that we can detect the binding event of this aptamer with the target molecule. Now, to get us to commercialization, where we are at right now, we have a lab prototype. We will then, about 8 months after funding, get to a proof of concept, and about 1.5 years FDA clearance, which then will move into manufacturing. Now, to help us develop, we're using MPR Associates. They're a design and development firm that has taken hundreds of devices, diagnostic tests from idea to market. We're right now seeking $500,000 to get to our proof of concept, and then we'll raise a capital round of $5 million to get this to market. Our financials look like this. Our sales will begin in year 3. Out of 200,000 doctors' locations, we expect to have an analyzer install base of 400, and that will produce about 180,000 tests a year. Year 4, 1,000 locations, and in year 5, get into nearly 2,000 locations and generating revenue of nearly $70 million. Now, revenue multiples for diagnostic companies right now are about 2.5 times. That would put us close to $150, $200 million and a great return on investment for investors. Our team includes myself, experience from Johnson & Johnson, the 2 inventors, a PhD in pharmacology, a PhD in biomedical engineering. Our scientific advisors include a former head at Welch Allen, Todd Morrill, who is at Biorad Life Sciences, a diagnostics head at diagnostics over there, and also a Berkeley professor, and then also an IP professional. Our company is a Delaware C corporation. We have rights to the university patent. We have 25,000 to date through grants and competitions. Additionally, there's been $6 million provided in university funding through DARPA and the NIH and the McKnight Foundation. So in summary, we are seeking $500,000 to get us to that next step. And what this will deliver for investors is really a proven technology that's been studied for decades. And what we've been able to do is find the key that can make this into a commercially viable diagnostics device. It provides superior value than what's currently out there. It's a platform technology, so not just heart disease, but many other diseases, brain and stroke as well. And then it's a multi-billion-dollar market. So I thank you for your time, and we look forward to talking to you. We're in booth 109, which is right here on this aisle. Thank you.